Hello. I'm going to keep this short. I just want to quickly introduce to you formally Dr. Olwyn Johnston. She is the medical director of the kidney and pancreas transplant program at Vancouver General Hospital. And I also have the pleasure of introducing our former patient. This is Teresa Atkinson. She is a 3-time kidney transplant recipient, and her most recent transplant was from the Highly Sensitized Registry. And so Olwyn and Teresa will be speaking to the Highly Sensitized Registry today and its benefits.
Thanks, Andrea. I do have conflict of interest with Highly Sensitized Registry because I am a transplant nephrologist and really want this to work because you guys are waiting a long time on dialysis. And I'm also a member of one of the Canadian Blood Services committees. So today I'm going to talk very, very briefly, because I know everyone's hungry for lunch, about the National Highly Sensitized Registry from the patient's perspective, the questions that patients ask. What is highly sensitized? How does it affect my chances on the deceased donor waiting list? And what are the options available? And also describing the benefits of this registry. So what is highly sensitized? Well, when a person gets exposed to for example, an infection, your immune system will want to destroy those foreign cells. So when the blood meets a foreign cell, it basically produces an antibody. So exposure to non-self human leukocyte antigens can happen via blood transfusion, previous transplant, or even pregnancies. So these are the exposures that make more people vulnerable to potentially being highly sensitized. And being highly sensitized in turn increases risk of rejection after transplant. So you hear the term panel reactive antibody a lot, and basically it's an immunological lab test, which you'll probably hear more about this afternoon from Dr. Land's talk. And the calculated PRA score, which is a percentage of the donor population to which the recipient will react via pre-existing HLA antibodies. So each population then has a different demographic of HLA antigens. So every immunology lab has a different panel. For the purposes of the HSP registry, we say that somebody is highly sensitized when that percentage of panel reactive antibody is greater than or equal to 95%. So when I'm referring to that, when I'm talking about that, that's what that means. So how does it affect the deceased donor waiting list? Well, up until we had the highly sensitized registry, about 25 to 30% of the active waitlist included highly sensitized patients. And before the registry, less than 1% of those patients were transplanted every year, which is dismal. So the population of highly sensitized patients on the waiting list was growing, which was very concerning to transplant nephrologists across the country. So we got together to form a plan of what was feasible to increase the chances of these people getting transplanted. In relation to the deceased donor waiting list, we saw earlier a snapshot of the waiting list, but it's different for people who are not sensitized and who are sensitized. And how is it different for highly sensitized patients? Well, very briefly, if you look at this slide, you can see that as from Tuesday, when I looked at the waiting list, there was 227 people who were active on the wait list, and you can see it's stratified to blood type here. And then for the highly sensitized patients, at the moment, we have about a third of that active waiting list who are highly sensitized, which is very concerning. You can see that various blood groups, the percentage who are waiting. Now, blood group AB is kind of torted because there isn't many people active on the blood group AB waiting list. So then if you look at our transplant rates, so in the calendar year last year, as Dr. Landsberg showed in the slides earlier, we did 164 deceased donor transplants, and of those, 8% were highly sensitized patients, which is actually a very good result when you think of less than 1% several years ago. In the living donor transplants, 110 done last year, and about 1% highly sensitized. Then in the year to date up until the 1st of September, our rates have been high, and our rates of highly sensitized patients being transplanted have also been higher. You can see here where the ceased donor transplant, 8.5% of patients were highly sensitized. And looking at our living donor transplant, also we're finding that more and more highly sensitized patients are getting transplant through kidney paired exchange, and you can see our rates have increased there as well. This is a very complex slide, but just looking briefly, particularly at the last 2 years, you can see where the waiting time has come down quite markedly for certain types of blood group, particularly blood group A. In green, you can see blood group B, which has always been disadvantaged over the years, but is possibly slightly improving. Then if you look at the waiting time by blood group per year, you can see if you look at this year, last year, 2015, again, 73 months waiting if you're blood group B from the time of when you start dialysis to the time of transplant. So for people who are highly sensitized, so in red here you can see highly sensitized patients, that waiting time is prolonged even further. And in 2015, the average waiting time for somebody who's highly sensitized was 87 months, which is just over 7 years. Then, according to blood group, it's similar to what was stratified for blood group for overall waiting time. So, what are the options then available for highly sensitized people? Well, we've talked a lot about this, and I'm going to concentrate mainly on the National Highly Sensitized Registry. We always offer these patients living donation if possible, as well as the Highly Sensitized Registry to open up all avenues for their possibility to get transplanted. So in relation to the National Highly Sensitized Registry, and I'm rushing through these slides very quickly, it's an interprovincial organ sharing program led by Canadian Blood Services and also integrated into the provincial procurement agencies. And it's basically sharing of organs between provinces under the auspices of the Canadian Transplant Registry to provide as much access for these highly sensitized patients as possible. It began for BC in June of 2014, and all provinces across the country are now involved. And there's a give and take, so we can't just take. We have to give. So there's like a to and fro of thresholds for importing and exporting. So in order to be qualified for the National Highly Sensitized Registry, again, your PRA has to be greater than or equal to 95%. You also have to be active on the wait list in your province and have end-stage renal disease. So people who are highly sensitized, who are preemptive and haven't started dialysis, are not entered into the National Registry. And the results have been fantastic. You can see here that in the first group of columns, this is the national data, and since its inception, a total of 258 transplants have happened, including Teresa. And that was up until September 16th, and we've done about 3 more since then in BC, and a lot more nationally. I've shown here as well some intraprovincial and interprovincial. Intraprovincial means that the highly sensitized patient from one province received a donor from that province. And it does happen, but the majority happen between provinces. Looking at BC alone, since we started in June 2014, we've done 24, and now it's probably up to 27 highly sensitized transplants. And looking at the advantages and disadvantages, I wouldn't call them disadvantages. They're impediments really to a highly sensitized registry. It's logistically very, very difficult and very complex, as you can imagine. We're importing organs from other provinces in a very time-restricted manner. So our coordinators, both at the retrieval side and from other provinces, have to have very, very good communication. There needs to be good communication between the ORs and provinces, between the retrieval of the donor and the actual transplant. Also, there needs to be a lot of communication between immunology labs between provinces, because once the organ and blood sample come to our province from another province, we have to redo cross matches, etc. So everything is very time urgent under these circumstances. Financially upfront, it is very expensive as well, because these organs have to be shipped from one province, have to be shipped to the province where the recipient is, which sometimes means chartered flights, etc., in the middle of the night. But overall, the advantages far outweigh the disadvantages. In the long term, this is very much cost saving. For the patient, they have far less time on dialysis and back to normal life quicker. Because of the national exposure, they have a higher exposure to different donors, which speeds up the process. So my summary. So as you can see, and this is very brief, the highly sensitized patients in our registry make up 25 to a third of the active patients on our waiting list. So, and their waiting times are very prolonged. Because of this, these are an extremely disadvantaged group of patients that we've tried to implement a lot of different mechanisms to try and speed up their time on the waiting list without disadvantaging them. So the National Highly Sensitized Registry has been a step in the right direction. Certainly we've seen a lot of progress here in this province, where our transplant rates have gone from less than 1% a year for highly sensitized patients to growing to 8% and 8.5% so far this year. So without further ado, I would like to hand over to our patient. This is Mrs. Teresa Atkinson, who received a highly sensitized transplant last November from out of province. And she has more experience than anyone I know of renal disease and transitions as part of our theme today. And she's going to give you a snapshot of her feelings and her thoughts about her journey. Thank you very much.
Hello, I'm happy to be here. I'm going to share just a little bit of my history. I know some of you probably know me because I've been around a while, but I have had kidney failure, diagnosed anyways, for 32 years. 24 of those years have actually been on dialysis, and 8 years with 3 transplants. So obviously I'm a difficult transplant. But having said that, I spent the last 15 years on nocturnal dialysis, which kept me alive and in good enough shape to be able to be eligible for a transplant. Had I not had that particular motive, I probably wouldn't be here today. So this new registry means a lot to me because it has given me back my life. It means that I can be an active part of society again, and to play with grandkids, to have the energy, to have the freedom to make trips to Mexico. Sorry, I lost a little bit of my track here. Sorry, I jumped through because of being rushed. So I'm just going to start in the middle a little. Sorry. I've had attempts to make fistulas, and my veins are very tiny and not very good. So I basically was facing end of life, and I was on my last neckline. I had no veins left in my arms, and this registry gave me hope again that I would actually find a transplant, being, I was told, 100% sensitized and a B positive. It wasn't very likely they were going to find one for me. So it definitely has given my life back, and in the last year I have been to Mexico and I have taken trips with grandkids, and I'm able to advocate for other patients, and it's been a really great experience. Thank you.